Hey, good morning. Tweed Jefferson here. It's like 4 in the morning here in California, but I'm up and I'm still waking up. Sorry, I'm not dressed up for y'all today. I'm gonna just have a chat. Today, I wanted to talk about the mental health care system as I've experienced it. Um, Sorry, I haven't been on as much as I'd hoped. I have some lambs coming this week for my property, so I've been getting ready for them, moving fences and building them a house and stuff, so that's exciting. Um, so anyway, I have aside from like random therapists and stuff, I have two experiences with actual mental health system. The first is in 2005 and the second was last year, so it's about a 15-year spread between the two of them. Needless to say, nothing's changed in 15 years, or I should say, nothing's improved. So, the first time that I got 5150'd, both of these are for threatening suicide, by the way. The cops show up, and no confrontation or anything like that. I'm not that violent kind of person. The only person I've ever been violent against is myself, despite what I write about in my books. um, so the cops show up and the ambulance shows up, and I get in the back of the ambulance, and the medic back there says, "Hey, can I put an IV in you?" And I was like, no, I don't like needles at all or anything like that. And he's like, "Well, I'm going to do it anyway." So I said, "Well, why'd you ask?" And he said, "Oh, I was just trying to be nice." And I said, "Oh, well, it's not very nice to ask and then not listen to the answer." And so he's going to do it anyway. And the cops are standing right outside the back of the ambulance. And I'm like, "Well, you know what? I think I'd rather just go to jail then." So I go to get up off the stretcher, and the paramedic jumps on top of me and starts strangling me, like full on strangling me. You know what I mean? Um, yeah, the cops are just laughing. No surprise there. So he jabs me with the IV, which, mind you, over the next 3 days, uh, they never actually used for anything. So I just had the fucking needle sticking out of my arm. Not for the full 3 days, only for the first day and a half till they moved me to a different facility. Anyway, so they take me to Community Hospital Fresno, and they only have like 4 or 5 beds in their behavioral health unit, which for, a metro area of like a million people, that seems right, doesn't it? So they put me in a chair, like a hard plastic chair, in a waiting room area. Bright ass fluorescent lights, everything like that. And I literally had to sit in that chair for 36 hours. They never got me a bed. And over that 36 hours, they never fed me. They never gave me any water. Nothing like that. The only thing I actually had access to was a phone for outgoing calls. So I was able to call my family and my girlfriend and stuff periodically. And there was this social worker called Lydia there, and she was not nice or caring at all, to say the least. But I think one of the most egregious things, besides not giving me food or water, even though I asked her, or a bed, or somewhere in the dark so I could sleep, or anything like that, was anytime my mom called to check on me, she'd yell at me like I had control over who was calling the nurses station, and she threatened to punish me by taking away my phone privileges if my mom called again. Like, what the fuck, right? So, anyway, after 36 hours, a social worker, I don't remember what he was. Anyway, somebody came and interviewed me and decided to move me to the other the actual behavioral health center, which was called PACT at the time. I don't remember what it's called now. It's the one by the fairgrounds in Fresno. So he moves me down there, and they put me in a room with a bed, which is nice, and I get to wait out my rest of my 72-hour hold there. Um, no medical care, no counseling. I do get to take one shower after asking the staff multiple times. Otherwise, no care whatsoever. And upon leaving, I have to meet with the psychiatrist who talks to me for about, 3 minutes. And he asks me, oh, do you ever feel happy? Yeah. Do you ever feel sad? Yeah. Oh, you have bipolar disorder. Here, prescription, right? Come on. And funny thing is that went in like my permanent record. So every time I go to the doctor now or anything, they're like, "Oh, you have bipolar disorder," and I'm like, "No, that was some jackass doctor throwing a prescription pad at me because he doesn't have the time to actually listen to what anyone says." So anyway, aside from Lydia and having to sit in that room, I guess that was a better experience than my second time because at least mostly I was left alone. Um, the thing about the mental health care system is like they don't actually do anything for you. They just stick you there for 3 days and then throw you out on the street, which we'll see in the next story too. Um, oh, and I want to mention that ambulance employee that choked me out worked for American Ambulance, and I'm going to do another video about them in the future because I used to work for them and they're just a big shit stain on the community. So anyway, let's go to last year, 2020. If you watched my last video, you know that I've been suffering from a lot of health conditions the last year and a half or so. Some of them are very painful, and a lot of them are very troubling, like severe memory loss and loss of my use of language, which frustrates me to no end. I can deal with physical pain, but like mental shit, losing my mind, not really. I've always said that like if I ever get dementia, just fucking take me out in the field and shoot me because I do not want to deal with that shit. Um, Although I would like to know if people with dementia are lucid about it because who knows if I'd even be aware what was happening at the time. Anyway, so last year, my condition was so bad I just couldn't stand it anymore. So I decided I wanted to kill myself. And my ex-wife was here at the house, and I told her that very thing. And I said, "Look, I think you should leave because I don't want you to be here when I do it." So she left, and after making things even worse by being all dramatic and even hitting me with her car because I tried to stop her from leaving and stealing my dogs, which, if you know me, you know my dogs are my most important thing. Look, here's one right here. There's Lebo. Anyway, um, sorry. So, anyway, then the cops show up at my house with their AR-15s pointed at me when I open the door, because that's a good way to deal with a mental health patient too. And they realize that I'm not going to give them trouble or anything like that. Again, I'm not a violent person. I just don't want to live my life in certain ways. So I sit outside and chat with the cops for about 15, 20 minutes while we wait for the ambulance to get here because I have to go through, I know the routine. After working in EMS too, I really know the routine. And one thing the cop says to me too, like I tell him, oh yeah, I was going through a spell and I'm actually sitting here. When they showed up, I was sitting here writing about it because that's my catharsis. And he's like, well, we got to take you in for my own liability. Like, what the fuck? His liability? Motherfucker, I'll put your name in my suicide note if you want to be like that because I don't give a shit about your liability and you don't give a shit about my health, apparently. So, good old Fresno Sheriff's Department. This cop was actually nice as opposed to, Deputy White, who is a total shitbag. So, anyway, get in the ambulance, take the ride, chat with the drivers or the medic in the back with me and stuff. They're pretty cool. They don't work for American. They work for another local ambulance agency. So, we chatted up and then we get to Clovis Community Hospital because I told them I definitely do not want to go to Community Regional. I should have just went to, Adventist Health or something like that because the whole community center is bullshit, in my opinion. So, get to the hospital, and they have a bed for me, but it's in a hallway, no room or anything like that. You know, lots of mental health patients, and not enough places to put them. So, anyway, I'm laying in this bed. I have to spend, trying to think, maybe about 18 or so hours there. And the whole time, I'm telling the staff that, like, I have this shit going on in my brain and it's fucking with me, and that's why I want to kill myself. But they don't seem to care. At the time, I was calling it a brain hole because, as I mentioned in my last video, it's not like a headache. It's like a void in my brain. So I didn't really know what else to call it. I've since learned it's better just to call it a headache because while I was at Clovis Community, I had to do a teleconference with a psychiatrist, and I told him about it, and he basically treated me like I was a crazy person because I was calling it a brain hole. Um, and I'm telling all the doctors and all the nurses and everything, everyone I talk to, like, hey, I need to figure out what's going on. One nurse even asked me, so this nurse, um, at one point, she's like, what do you feel like? What's your emotional state? And I said, nothing. And she's like, you mean emptiness? And I'm like, no, nothing. And of course, she writes down emptiness. Like that's not the same thing. You know what I mean? Like, I'm, I'm, I'm not an emotional person normally. And so for me to feel no emotions is status quo for me. And at one point, she even asked me, like, when I keep telling her about this, she's like, well, what do you want us to do for you? And I was like, oh, I want to blood tests. I want an MRI. I want a CT. I want to know what the fuck's going on so I know if this is organic or if it's like truly mental health. And of course, I get none of that. Um, this continued on through the whole time, by the way, as I moved over to the other mental health place, and I kept telling everybody about this issue, and nobody gave me any care, even though when I was checked into the mental health facility, they gave me a patient's rights packet, and like the very first thing in it is, you have a right to medical care, yada, yada, yada. And I'm even showing this to the staff, like, look, you guys gave me this shit, and I want medical care. And no one would give me any. And the funny thing is then when I later got out, and a few months later, I filed a grievance with my insurance company and gave them all this information. Community hospital and community behavioral health, or CBHC is all referred to it, basically said, "Nuh-uh, he never told us any of that. We gave him the highest quality of care." So, yeah, you know, that's great. So, anyway, I'm at, after being at community hospital, I moved over to the CBHC. And mind you, this is at the height of the COVID pandemic. So, um, I tell them, oh, I'm worried about that. So initially, they give me my own room, which is nice. Also, because I don't like sharing room with other mental health patients, because not that I want to judge them or anything, because we all have our issues. But I'm, let's say, stoic, and other people are a little more dramatic. So, anyway, they put me in my own room. However, they don't allow me to wear a mask at any point, even when surrounded by other patients and healthcare workers. And they don't allow any social distancing. So, like when we got to go out to meals or that sort of thing, we got to line up shoulder to shoulder with no masks and stuff, which I'm not a fan of. Um, so, the food. Let's talk about like actual care. Like, you put a patient somewhere and then you basically treat them like they're shit, and um, how do you expect people's mental health to get better? You know what I mean? Like, so the food they gave us was on the brink of inedible. Of course, I ate it because they stand there and watch the whole time and take notes. So, like, I want to pretend like everything is normal regardless. You know what I mean? And we're talking about like chicken that's hard as a rock, and big old wedges of iceberg lettuce that they call a salad. I I wrote it all down. I don't know. I'm not going off my notes today, but I actually did journal the whole time I was there. But the point is like if you're gonna provide people with crap food, like how do you expect their mental health to be better? Physical health and mental health are tied in. You know what I mean? The one thing they will give you though is all the packets of sugar and ketchup and ranch and all that you want. So even if you have crappy food, you can drown it in basically sugar. And again, great for mental health, right? You know, burnt pancakes, and it was just disgusting. And the other thing, tying in from physical health to mental health, is like we got an hour of gym time a day. And personally, I would rather just sit there and write. But again, I'm trying to pretend like everything's normal. So I go to gym time, and it's like, it's a joke. They got a basketball hoop indoors, but all the basketballs are like half flat. So you can't even dribble them. And they've got exercise bikes, but they're electric exercise bikes, and they've cut all the cords off of them. Um, so they don't do anything but just spin freely. Like you can't get any tension or anything on it like that. Um, so I basically would just go around the room and like shoot a couple of basketballs and sit on the exercise bike and spin my wheels, so to speak, for a few minutes, and then spend the rest of the hour writing. Um, Several times a day, they take your vitals, which they got totally wrong. Like at one point, they told me my respirations were like 25, and I mean, I'm very mindful of my breathing at all times, and it's like my general respirations are between 6 and 8. Like I'm a slow breather, but 25, I mean, that's like, come on. I mean, I would know if I was breathing like that. And then they always ask the same questions. Are you hearing voices? No. Are you thinking about hurting yourself right now? No. You know, pro tip, always say no to that question in mental health if you go there because they're just going to keep you longer if you say yes. And so don't do that. And, you know, every time that they did this, I tell them about what I was now calling a headache because I had learned over at Clovis community that don't call it a brain hole because they treat you like a crazy person. I mean, they treat you like a crazy person anyway. And, I mean, the level of indifference, let's say indifference is the nicest way I can put the way the staff treats the patients there. And, you know, when they give you meds at night, you have your choice between orange juice and cranberry juice. It's like, why do I want to keep putting more sugar into my body? Like, don't you guys understand that just loading everyone up with sugar is not good? But, like, that's basically all they do is just load everyone up with sugar. The activities for the other, you know, 22 hours a day that you're not either eating or at, quote, gym time is basically watching trash TV, daytime network TV, Judge Judy, and shit like that, or coloring or pacing the halls and talking to yourself. That's basically all anyone did there. So, you know, they did provide me, and this was my saving grace there, I guess, with little notebooks and little golf pencils. And I wrote about, I don't know, 150 pages while I was there. And that's actually, I published a bunch of my personal journals last year, you know, like 400 pages of them, which isn't much considering I have a box of papers from over the years. And I actually destroyed most of my journals and personal items and photographs in 2008. So all that stuff's just from 2008 to now. Um, so anyway, the only thing I ever said to the staff was, no, I'm not hearing no voices. No, I'm not thinking about hurting myself. And can you sharpen my pencil? And the brain hole thing. Like, that's literally all I could say. So daily, you have to meet with a psychiatrist. There's this psychiatrist there called Dr. Adapa. Oh, I want to go back real quick, back to community hospital, since I'm sitting in a bed in the hallway. Like, the staff literally spent their whole time talking shit about patients. Like, I mean, I could overhear them, and I don't know. It's the same as when I worked for American Ambulance. Like, everyone just talks shit about their patients and everything all the time. There's no actual care going on. It's just like they're doing their job. And that's one of the main reasons I left American Ambulance. Again, I don't want to detract because I'm going to get into that in depth in a future video. So I have to meet with this psychiatrist at CBHC, Dr. Adapa, and she's a total bitch. And basically, all she does is ask the same questions that the nursing staff asks every day about hearing voices and wanting to hurt myself. And I'm telling her about this brain hole thing, headache, as I phrase it, and the memory loss, and yada, yada, yada. Um, and she's like, whatever, I don't give a shit kind of attitude. By the third time I met with her, I'm like in tears, which for me, I don't cry. And that's not being a tough guy or anything like that. That's just, I mean, I don't know. Maybe it goes back to my childhood and, being criticized for crying or worse. Or maybe it's my own mental health. I mean, like, I have a hard time with emotion. And as I'm crying, just saying, I don't know what's going on. I want to figure out what's happening, yada, yada, yada. She's like, well, you could talk about it in group. Now, you got to understand that group, which also happens once a day at CBHC, is everyone sitting around and bitching and being confrontational and arguing with the social worker who mindlessly sits there and goes, well, how does that make you feel? Well, how does that make you feel? Well, how does that make you feel? It's like, it's a joke. Like, and everyone's just arguing all the time. Like, there's no actual therapeutic value to their group sessions or anything like that. But again, and this is that, like, gym time is optional, but I go anyway because one, I want to break up the monotony of my day, and two, I want to pretend for them since they're always watching and taking notes, except apparently taking notes about my actual health. Um, so on Monday, so I went in on a Friday, I got out on a Monday. So on Monday, I meet with a new doctor, Dr. Chaya. And this guy was actually like, oh, sorry. See, I'm going off script, but so I go to the nursing staff after meeting with Dr. Adapa for like the second time. And I tell him, like, hey, I'm telling her all this stuff, and she's like, not giving me any care. And the nursing staff's basically like, oh, yeah, she's shit. Like, you got to wait till the good doctor comes in. And it's like, the good doctor? Why don't you guys just have a good doctor? You know what I mean? And then they start making racist comments about her in front of me, mind you. Like, they're making comments about her being Indian or whatever. And that's, first of all, not really right to judge somebody based on that. And second of all, why would you say that in front of a patient? You know? So I meet with Dr. Chaya on Monday, and this guy actually listens to me. And, he tells me a lot of the stuff I'm saying about the doctor and the nursing staff. He's like, oh, yeah, I hear that all the time from the patients. And it's like, so nobody's ever going to do anything about it? You guys are just going to be like, oh, yeah, we know all about it, but nobody gives a shit enough to change things. Unfortunately, when I talked to this guy, he is like a rotating kind of doctor who goes between different hospitals and facilities just to assess patients. Because I'm like, well, can you be my doctor? Because I've had pretty shit experiences in the past. And he also specializes in neurology. So, when I tell him about my condition, he says, oh, yeah, you definitely need to see a neurologist. But he can't because he's not allowed to take on actual patients. And so, anyway, he signs the release for me to get out because obviously I'm not fit to be there. And he tells me as much. So before I leave, I have to meet with a social worker. And this guy was actually a pretty decent guy too, except minus the fact he kept trying to push his religion on me, Christianity, obviously. I don't know if any other religions try to evangelize like that. But and then he's got to provide me with resources for when I get out. Well, the resources are basically like a page saying go to county mental health. And county mental health is like DMV for mental health patients. It's ridiculous. I've gone there before to try to get medications, and I mean, try getting your meds from DMV, right? But I'm out. I'm free with no medical care, no mental health care, and no resources for when I get out. So basically, I'm in just as bad or worse condition as when I went in. I mean, I would say worse because I had to leave my house and my dogs and my life for 3.5 days. And, I've talked to, when I was a dispatcher, I had someone sit with me who is a supervisor for NAMI, National Alliance, I don't know, National Alliance of Mental Health, something. I don't know what it stands for. Anyway, but I had started telling her some of my stories, and this was before my second 5150. And she's like, yeah, that's pretty much how it is. And it's like, it's just such a joke that, like, mental health patients, I know that, the healthcare system in this country is broken, but, like, why even have these facilities if they're not going to do anything? Like, may as well stick people in jail. At least, like, there's some social interaction and stuff there. So, anyway, I mean, that's not all the details of what happened when I was there, but it's a part of it. Oh, and day two at CBHC, they put me in a room with three other people, which fortunately the guys they put me with were pretty decent. One guy sat up all night staring into the dark and talking to himself, but other than that, no one was violent or anything like that, and that's all I really care about. Again, I have compassion for these people, but I don't want my own health to be at risk, or safety, I should say. Um, so, anyway, when I got out, I wrote up this business plan. I have, this would be number 4, I guess, for me, of nonprofit centers I've wanted to start, from my after school program for kids on the spectrum to my law enforcement nonviolence training center, where, I teach cops how to use nonviolent techniques like Aikido, and this facility, which, I would do it somewhere like where I live now in the mountains, would be for people to voluntarily come when they're having mental health episodes to escape and to get real support and not judgment and not any of the, standard bullshit lines. Like, let me tell you something. If you're talking to somebody who is dealing with suicide and stuff like that, it's stupid to just regurgitate the same crap. Like, oh, you have so much to live for and things are going to get better. You don't know that. And maybe things aren't going to get better. And somebody in that condition doesn't feel like they have so much to live for. I mean, my dogs have saved me more times than anything because I don't want to abandon them. Um, but I don't know. I think just listening, talking, relating stories is far more beneficial than just, saying the same old shit over and over again. And, and then there's the more toxic stuff, like I've been told my whole life by my family, like, just get over it, be a man, you're choosing to feel like this. You could just choose to be happy, etc., etc. It's it's bullshit, man. Like, we need to be supporting each other and giving actual love and really truly listening, not just like saying, I mean, I know it's uncomfortable for people. I know that I've sacrificed friends and relationships by being too open about it. And one of the reasons that my wife and I split up is because she couldn't handle my depression. In addition to telling me she didn't want to be my caretaker when I got sick with my physical condition. So, as I mentioned in the last video, I don't want to keep repeating myself. I tend to do that, though, because I do have memory problems, although they're going pretty good right now. Um, so, anyway, back to the mental health facility I wanted to start. The idea would be able to have people come up here into the mountains where it's peaceful and beautiful and camp out or, have some little cabins or that sort of thing and have people work as a community support. And like, I mean, nobody's in charge. Of course, myself or maybe some staff members would supervise, but we'd all be in charge of taking care of each other. We'd work on healthy, nutritious, delicious meals together. We'd work on exercising together and talking about ourselves and playing music and singing or whatever, art, whatever people wanted to do that was beneficial to their minds and bodies, because it should be about healing, not just holding people down and telling them you need to get better. Like, people don't get better just because they're told they need to get better. Um, I don't know. Anyway, I don't have a whole lot more to say on that. I mean, I can talk forever, but I'd just be saying the same crap over and over again. Um, Again, just like I said before, if anybody wants to talk about this, if you're feeling depressed, suicidal, anything like that, I'm happy to Zoom with you and not tell you the same crap over and over again. I'll just listen, or I'll tell you about my own experiences, or, we could talk about music, or we could talk about whatever. I mean, just to know that somebody's there and I don't want to say cares about you because it's hard to say that it's like some stranger actually cares. That's one thing about the suicide hotline. That and the one time I called, I was on hold for 30 minutes before I hung up. So, real effective system there, right, guys? Um, you know, let's try to be there for each other more. Let's try to be patient more. I mean, a lot of us, including myself, don't know how to express ourselves appropriately. Um, we've been through situations where we've been invalidated so many times throughout our lives. I'm 39 years old, and I have a hard time thinking, I could probably count on one hand the people who haven't invalidated my feelings when I've said things like that. Actually, I could probably count it on one finger. Um, so, you can't always count on your family to support you or your friends. I mean, hopefully you can, but I went through many years of my life where my friends were my drinking buddies or my bandmates or that sort of thing. And it's like, I'm bad enough about reaching out already, but I can't reach out to people who are just going to um, spout, it's going to get better at me or want to just ply me with alcohol. I appreciate the thought, but it's it's not helpful to a lot of us. And those of us on the spectrum too have an even harder time expressing ourselves, which is one of the reasons I'm doing these videos, because I have a really hard time expressing myself and sharing and being open. So this is practice for me. Okay, well, I guess that's all I really have to say about that for today. I hope everyone has a beautiful day, a wonderful week. I hope to talk to you again in a few days or maybe tomorrow. I have a friend coming tomorrow, and we're actually going to try to plan some, hopefully, some like, I don't know what to call them, healing clinics up here at my property. Like, you know, people come up for the weekend and we just do yoga and meditation and aikido and whatever, but just some healing weekends. So I hope we get to plan that. And I got the lambs coming this week, so that's awesome. I'm really excited for the babies. And so I might not see you for a few days, but it is what it is, right? thewallsinstead.com, Facebook, Instagram at thewallsinstead. Shoot me a message if you want to talk. And, I'm not available 24/7. I'm just one person, but I do want to speak with you if you need to talk to someone. All right, guys. Peace and love. I'll talk soon. Be well.